this announcement in English and Spanish. Bienvenidos a todos y todas. Proporcionaremos interpretación en la sesión de hoy y anunciaré este mensaje tanto en inglés como en español. We invite everyone to please select English if you are monolingual English speaking or limited in your Spanish proficiency. And in this way, you'll be able to hear the interpreters from Spanish into English in case anyone makes a comment in Spanish. And presenters, please remember to speak at a moderate pace because we do use 30% more words in Spanish. If you're at the computer at the bottom of your screen, you'll see a globe and it says interpretation. Put a check mark on your preferred language. If you're on a cell phone or tablet, locate the 3 dots, tap it lightly and put a check mark on your preferred language, and be sure to click done to activate the interpretation. Friendly reminder, if you see the interpreter raise our virtual hand, please make sure to speak more slowly. Les invitamos a todos a seleccionar el español si está limitado en su dominio del inglés. Y de esta manera usted puede escuchar a las intérpretes del inglés al español. Si está en su computadora, hay un globo en la parte inferior de su pantalla y dice interpretación. Y ahí usted puede seleccionar español. Y hay que poner una palomita. Si está usando su celular o tableta, ubique y toque los 3 puntitos ligeramente y ponga una palomita en español y seleccione Done o Finalizar. Este último paso es muy importante para activar la interpretación. Recordatorio, si ve al intérprete levantar la mano, favor de hablar más lentamente. Gracias. Thank you.
Thank you so much. And thank you, everybody, for joining us yesterday and also this day 2 of our convening. As a reminder, I'm Emily Stewart. I use she, her pronouns, and I'm the Executive Director of Community Catalyst. So I have the distinct pleasure of introducing Secretary Becerra, and I know he needs no introduction to this group of health justice leaders, but I am thrilled to welcome him to Community Catalyst's convening. Secretary Becerra is the first Latino to hold the office of the Secretary of the United States Department of Health and Human Services, and he is a longtime champion of health equity, spanning his time in Congress as the Attorney General of California and now as head of HHS. The Secretary's track record on health equity is very long. We are especially grateful for his unwavering leadership in Congress to pass the Affordable Care Act, as well as his leadership to protect the law against political attacks. As California Attorney General, he successfully defended the ACA against Texas's challenge to the law in California v. Texas. And of course, he won that fight, which we are so grateful for. And we're also grateful for his leadership to protect other core tenets of the law. For example, his leadership in defending the ACA's birth control benefit when the Hobby Lobby case was making its way through to the Supreme Court. We are honored to have him with us today and for the work that the Biden administration has done to advance health equity, from lowering the cost of prescription drugs to strengthening ACA non-discrimination protections to protect access to abortion and gender-affirming care, to tackling the issue of medical debt through tri-agency efforts. The Secretary has spearheaded an enormous amount of policy change designed to make healthcare more affordable and accessible for all. And we so look forward to what HHS is planning next under his leadership. And so with that, I will turn it over to Secretary Becerra. Thank you for being here.
Emily, first, if I can say to you, thank you for the very kind words, but more importantly, thanks for all the work that you and Community Catalyst do, for the people who are behind Community Catalyst, for the years of a push, of dogged, tenacious determination, for not giving up. We're seeing the fruits of that. In this administration, President Biden has been able to deliver on much of what he committed to as a candidate for president when it came to healthcare. He said, and I remember this, he said, we're going to lower costs for more people with better benefits. Pretty simple, but hard to deliver. But in this case, with all the work that you've done and the help that you all have provided, it's happening. And I'll mention some of the things that we're doing. But I just first have to say to you and everyone, Community Catalyst and everyone who works with you, thank you for giving us that wind that lets us really fly high. I also have to say, even though I really can't see you in person, I probably know most of you who are on. Either I know you personally, I really do, or I just know who you are. Because if you're on this Zoom, if you're participating with Community Catalyst, I know you. I know what makes you tick. I know why you're here. I know that you probably give up a lot of your personal time to do this work. I know that you have personal stories of how important this is to you. I know that you're not going to stop. And I know that we're going to see each other again. So I know you better than you think. And I am pleased to be with you. I feel I'm with family when we talk. So health justice, what does it mean? For me, you know what it means? It means peace of mind. Peace of mind that if you have to take your child to the hospital, you're not going to go bankrupt. Peace of mind that you decide what healthcare you need, whether it's because you're a woman and you want to have reproductive healthcare services, or you're aging and you want to be able to make the best decisions about your life or about death, and they're yours to make. Peace of mind means if you do go to the hospital for your child or for yourself, that you won't be broadsided a week or two later when you see a bill come to your home that you did not expect. Peace of mind means knowing that your care is not just for your body, but there will be healthcare for your mind, because too many people today know that having access to mental health services is nearly impossible. To me, healthcare is peace of mind. And I hope each and every one of us is striving to make sure every American, regardless of income, regardless of geography or zip code, regardless of status, immigration status, can have peace of mind. And so let me tell you what we're doing at HHS to try to give people peace of mind. And I start with what I believe, I hope we're leaving the cornerstone for what I believe will be healthcare moving forward into the 21st century. And that is, we stop treating healthcare as illness care, but as a system that treats and promotes wellness. The sooner we move from illness care to wellness care, the more peace of mind people will be able to have, and the less money they'll have to pay out of pocket to get it. And so it shouldn't surprise you, at the Department of Health and Human Services, we believe food is medicine. And we want to be able to support and fund and authorize those who believe that food, nutritious food, is medicine. And so whether it is making sure you're not a food desert in your community, making sure that the school lunch program gives you nutritious servings, or whether it's simply making sure that if you are a worker in America, you should not have to make a trip to the food pantry on your way home so you have enough to eat. Food is medicine, and that means so many things to so many people. Secondly, for us, if we really want to move towards a wellness care system, and then we have to talk about avoiding the sicknesses, the chronic illnesses that really drive our system to be very inefficient. And that's where, as many of you probably heard me talk about, because again, as I said, this is a family affair, this conversation. My mom, I always mention my mom because she's the one that always said to me, and again, I didn't get it when she would say it to me as a kid because it didn't make much different. Mejor prevenir que remediar. Better to prevent than to remediate. And that applies to so many things, but in healthcare, it's golden. Or as I always try to say to folks, Frederick Douglass said it far more eloquently, perhaps, than my mom did. And he said it about 160, 70 years ago. It is easier to build strong children than to repair broken men. Because today we know we have a lot of broken men and women, and it takes a lot of money and a lot of effort to try to repair them, because we never spent the time to really build them strongly when they were children. And so at HHS, we want to build strong children. For us, that means something as simple as treating a healthcare dollar that we provide to the states and to communities very differently from the rigid walls that stood in place for healthcare funding in the past. So if you are a Medicaid recipient, we think a dollar that we spend, a taxpayer dollar that we spend on you, is as efficient if I spend it to make sure that you are housing secure so you don't become unhealthy and sick and end up in a hospital, as it would be spending that dollar for you to stay in a hospital. In fact, quite honestly, it'll be far more effective if I prevent you from going to the hospital. And so we're now working with states that want to innovate and want to be able to holistically treat Medicaid beneficiaries so that you don't wait till they have to go to the hospital or to a doctor. You start providing them with access to nutritious foods at the beginning, or you make sure that if someone is on the verge of becoming housing insecure, that what we're doing is making sure that we can combine a Medicaid dollar with a HUD dollar, a housing dollar, with a community services dollar, so that we can keep you housed, keep you accessing your preventative services, and therefore you avoid the hospital. Those are all very simple things that we can do. And I hope we all do them together. And I should mention a couple of other things that we're doing that don't go to the heart of wellness care, but are essential triage work that we're doing now. That Medicaid beneficiary I mentioned, today Medicaid beneficiaries often are losing their care, not because they don't qualify, because they don't know they have to re-enroll. As a result of the public health emergency coming down after the COVID pandemic, the height of the COVID pandemic, now people have to re-enroll. It's the way all of us re-enroll for our health insurance for Medicaid. But a lot of folks don't realize it because for 3 years, they didn't have to re-enroll for Medicaid. We don't want anyone to lose their health care simply because the bureaucracy, the miscommunication has someone lose their health care. And so I mentioned Medicaid redetermination process and getting people re-enrolled because, as I said, I know I'm talking to the champions, the troopers who make it possible for us to get to people. And I hope you'll help us with this process of getting states to re-enroll all those Medicaid beneficiaries that are once again having to apply to make sure they qualify for those benefits. And then I wanted to mention one other thing. If you are broadsided, as I mentioned before, by one of those healthcare bills, because you were not expecting it, your child just came back from the hospital, 3 weeks later, you're getting this bill that you did not expect, you have relief. There is a law in place that we are enforcing that says that a patient can no longer be in the middle of that food fight between the insurance payer and the hospital provider when it comes to a particular bill that was incurred as a result of you or your family member going to the hospital. If any of you encounter that, please know that you are not, by law, any longer supposed to be placed in the middle of that food fight. And if you are, then contact us because we want to make sure that you are not strapped with that kind of financial burden. All that is part of this process of trying to move us in a different direction when it comes to the way we look at healthcare. But none of that gets done unless all of us participate. And that's where Community Catalyst comes in. Not only did you help us get the ACA across the finish line, not only have you helped us make sure that we're getting people enrolled in the Obamacare insurance plans. By the way, never in the history of the country have we had more Americans have access to healthcare because they have their own insurance, whether it's private insurance, employer insurance, or public insurance, Medicare, Medicaid, S-CHIP, ACA. You all made that happen. And I think you deserve a real shout out because more than 300 million Americans today have access to healthcare because they're insured. We reached a point where less than 8% of Americans were uninsured, something we'd not ever seen before because we were always in double digits. You deserve credit for much of that. And so as we build, please know it is you who makes this happen. Without you, those trusted voices, it would be far more difficult to get things done. And so I want to close simply by saying that I feel very comfortable knowing that I'm speaking to family here. My mom would be very pleased that I mentioned her mejor prevenir que remediar admonition. She would be very pleased to know that I'm talking to those who have made things happen. And at the end of the day, I think what's critically important is to know that Community Catalyst, Emily, you and your team, and everyone who comes in and forms that giant army that we need. We have work to do, but we're going to get it done, because at the end of the day, we're not interested in just trying to cure people who have become ill. We're interested in making sure that everyone, whether you have wealth or not, whether you have a bachelor's degree or not, you do have access to the care that you need. That's the bottom line. And that's what health justice looks and sounds like. At the end of the day, we all deserve that peace of mind, regardless of how many jobs we have, what kind of illness we may encounter. Peace of mind. So thank you to each and every one of you, my family, for giving America a chance to reach peace of mind. Emily, back to you.
Thank you so much for being here. What a beautiful vision. Health justice is peace of mind. I'm seeing lots of chats. People are really excited by what you've outlined, and we're so excited that you joined us, and we know you got to get back to the work of running this department that is doing such great work, and we're just very excited and grateful to be pushing in a different direction together. So thank you so much, Mr. Secretary. Thank you for being here, and I will be actually transitioning us to By Hayes, our music transition, just to help folks reflect and absorb what the Secretary has outlined before we move into our breakout groups. Thank you very much.
Good morning, everyone. Good morning. How are we doing today? I am By Hayes. I am the sound healer for today, and I loved what the senator had to say. I actually pulled some cards that are relevant. So before we start with the meditation today, I just want to share a few affirmations.
We're having a little bit of technical trouble. We can't hear By Hayes. Or give us just a second here and we'll figure that out.
Hello, are we good with hearing me right now?
We can hear
Yes,
your
sir.
voice.
We can hear your voice now.
Okay. Thank you. I was saying, good morning, everyone. I'm grateful to be here. And I pulled 3 cards just to set the tone for today. If you came to the workshop, we were doing affirmations yesterday. So I just want to continue that energy. And the first one I pulled was, I radiate love. I radiate love. The next one I pulled said, I prioritize healthy communication with others. I prioritize healthy communication with others. And then the last one is, I overflow with creativity and good ideas. I overflow with creativity and good ideas. So let's just hold those in our hearts as we start for the day. I invite you all to close your eyes at this moment. Close your eyes and just get present with your breath. Take a moment to identify the sections in your body that may be tense, that may have any anxiety right now. And again, we're going to just relax and breathe into those areas. Just allow for the sound of the bowls to wash away any tension. Allow the bowls to ground you in the present moment.
Repeat after me. I radiate love. I receive love with open arms. My capacity for love is infinite. I am worthy of the love that I give. The love I seek starts within me. I receive my blessings with open arms. I am ready for my abundance. I am blessed. My life is a gift. I am a magnet for success. I am grateful. Everything that I need is within me. I start and end my days with gratitude. My mind is clear. My body is at ease. I am kind to myself. I am free. I am loved eternally. I've got everything I need.
So just begin to come back to the present moment as we allow for those affirmations to soak into our minds. I just hope that you all feel grounded and ready to learn, ready to share. And I just want to thank you for showing up for yourself. Let's just take one collective breath together. We're going to inhale for 3, 2, 1. Hold for 3, 2, 1. And exhale for 3, 2, 1. I'll be putting the affirmations in the chat box if you want to hold those or reflect on those on later. And I just want to say thank you again. And I'll see you tomorrow. I'll pass it back to the host.
Thank you so much, Hayes. That was lovely and grounding. We really appreciate all the work that you're putting into helping keep us all breathing throughout this week.
It's my pleasure.
And now for everybody else, now that we've had a moment to, recenter and reflect on Secretary Becerra's remarks, we're going to spend the rest of this session learning from each other about the specific health justice topics that I think you all came here for. We know that each of you are bringing a wealth of experiences and expertise to this convening, and we wanted to create a space for you to share and build together. So in a few moments, you'll be able to self-select into breakout groups, each of which is centered on an important aspect of health justice and health equity. So those groups include immigrant health, coverage and care, corporate and hospital accountability, medical debt and affordability, the public health emergency unwind, reproductive freedom and LGBTQ health, and the health workforce. Each of these breakout groups will be facilitated by a Community Catalyst staff member who has prepared questions for your group about how and where we can draw connections between these issues and the vision that Secretary Becerra laid out in his remarks. But we're also hoping that more organic conversations will emerge from these prompts to help you connect with advocates from across the country on topics relevant to your own work. So Trey Manisha, I think, is going to pop on and help us understand how to self-select into those breakout groups, and then we'll get going. I do want to note for people that we will not be coming back to the larger group, and so your facilitators will help you kind of understand next steps, when your discussions are finished. Trey Manisha, are you there to, and or the tech folks, are you there to help us get into those groups? Okay, termination might be muted. So what I'll say is at the bottom of your screens on the right-hand side, for some of you, it'll be visible. There'll be a little button that says join breakout room. For others, it'll be in the like ... more tab at the bottom of your screen. So you'll click on that join breakout room and all of the sessions will be listed there. You can click the little join button next to the topic that is of most interest to you. Are we ready? Okay, go ahead and join your groups. If you're having any trouble, raise your hand or just private message me and we'll try to figure out how to get you into the right group. Okay, sorry, if you're just joining us or if you missed it, so you'll go down to the bottom of your screen where the chat function is, the different captions and the reactions are, and at the very end you should see a tab that says more, like ... more. So you'll click that and a little option to join breakout rooms should appear. Once you click that button, there's 7 breakout rooms that you can choose from. You'll just click the little join button next to the one that's of most interest to you. Colin isn't being able to get into his. Okay, Colin, can you tell us which one you're trying to get into, and maybe our tech support can help?
Yeah, the
PHE one. Tim, can we help Colin get into the PHE Unwind group? Michael, which group are you trying to get into?
I am trying to get into corporate and hospital accountability.
Okay. Tim, can we help Michael Miller get into corporate and hospital accountability?
There we go.
Perfect, thank you. Colin, are you still having trouble? If you are not interested in joining a breakout room, that's okay. Take a few moments for yourself and regroup and reflect. And Trimanisha can kind of help folks figure out if they're continuing to have trouble. Does that work, Trimanisha?
Yes, thanks, Jesse. I had some technical issues myself, but I'm back.
No problem. Okay, I'm gonna hop off.
Thanks, Jesse. So for folks that are looking to figure out how to get to the breakout rooms, at the bottom of your screen, you should have one or of 2 buttons, either a button that says breakout room that will directly lead to you to either one of those breakout rooms, and you can pick and choose the topics as Jesse explained, or there'll be 3 little dots at the far right end with that, and underneath those 3 little dots, it'll say more. If you click on join breakout room, you'll have the listing of all the breakout rooms there, and then you can decide whether or not you want to go to immigrant health, coverage and care, corporate and hospital accountability, medical debt and affordability, PHE unwinding, reproductive freedom, and LGBTQ health, or health workforce. So once again, at the bottom of your screen, you'll either see 3 little dots on the far right with a button that says more. You can click on join breakout room, and then you'll see a listing of the breakout rooms, and you just right-click on whichever one that you would like to go into. If you have any questions, you can definitely come off mute right now, and I will help walk you through it.